I'm going to give a brief talk about the new technology we discovered for cancer immunotherapy. As we all know that cancer is a major health problem in the world, and about 40% of us will be eventually diagnosed with cancer in our lifetimes. For example, in the US, in the 2022, there are about 2 million people were diagnosed with cancer, and about 600,000 people will die from cancer. Currently, there are different options for cancer patients. So if you can diagnose a cancer in the early stage, you can do surgery to remove tumor. Otherwise, you have to do chemotherapy, which is standard therapy right now for most of cancer patients. You can also do radiation therapy for the cancer patient. And all these therapies, they have some limitations because they have pretty high toxicity and the efficiency is very limited. In the last few years, a new therapy, which is called immunotherapy, particularly using checkpoint inhibitors, has attracted much attention for cancer therapy because they have high efficiency and they have less toxicity. However, all these checkpoint inhibitors, they are made from monoclonal antibodies. Although the monoclonal antibodies have many advantages, it also has several limitations. For example, they are very expensive to make, so the cost for immunotherapy right now is very high for patients. And because it's a very large molecule, so the tumor penetration of monoclonal antibodies is very limited. That may affect its efficiency for some of the solid tumors. Another major disadvantage for monoclonal antibody is that it cannot be given by oral administration. So right now, all these antibodies have to be given by injection, which is not very convenient for patients. It's also difficult to use antibodies for combination therapy because for many of the cancers, you have to combine the different drugs to achieve the highest efficiency. So combination therapy is very important for cancer immunotherapy. Another disadvantage for antibody is that you cannot use antibody for tumor imaging and diagnosis. Because of these limitations, there's a huge interest in the last few years to develop small checkpoint inhibitors. In our lab, we developed a small peptide-based checkpoint inhibitor for cancer immunotherapy and diagnosis. There are many advantages for peptide-based checkpoint inhibitors. Number one is it's very easy to make peptide. So the cost of peptide-based therapy is much cheaper compared to antibody-based immunotherapy. It has better tumor penetration because of the small size. It is very safe. It has very low immunogenicity. And another big advantage for peptides is it can be used for oral administration. That is a huge, huge advantage for most patients. Also, the peptides can be easily used to construct combination therapy, so you can target different pathways for a certain cancer. Also, these peptides can be used for different chemical modifications to increase its stability as well as its activity. We discovered anti-PDL1 peptides and we demonstrated its anti-tumor activity in a mouse model. As you can see here, for these mice, we implant tumor cells, and then once the tumor reaches a certain size, we give the treatment. We compared all the peptides with antibody, which is a control. As you can see here, for this antibody, it shows a significant tumor inhibition effect, and our best peptide, which is C7, shows even better tumor inhibition effect. For this anti-tumor activity study, we give the treatment by the injection. We inject this antibody or peptides into the abdomen of the mice. In another study, we try to see whether these peptides can be given orally. So here, instead of giving injection into the abdomen of the mice, we give the drug by oral administration. As you can see here, for our peptide, it shows a significant tumor inhibition effect even after oral delivery, which is very challenging for other protein therapeutics, such as monoclonal antibodies. And also, this peptide didn't show significant toxicity because all the groups, as you can see here, they have similar body weight. We didn't see any changes in the body weight. In summary, we have discovered a very efficient peptide-based checkpoint inhibitors, which can be used for oral administration. It can be used for combination therapy, and also it can be used for non-invasive imaging. For example, you can use these peptides to detect whether the patient has a PD-L1 positive tumor, because normally if the tumor is PD-L1 positive, then the doctor can give the PD-L1 inhibitors for the treatment. Right now in the market, there's no peptide-based checkpoint inhibitors. There's no oral medication for cancer immunotherapy, and there's no non-invasive tumor imaging agent for the detection of PD-L1 positive tumor. We have filed a patent for the peptide-based checkpoint inhibitors, and we have done comprehensive preclinical studies to show its activity as well as safety in using different models. We are looking for licensing of our technology, and we are also looking for collaboration to file a PDC patent to develop an imaging agent using this peptide, and also to move the peptides to the clinical trial. Thank you.